Hello guys, this is Suraj and let's continue our discussion with anemia. What are the symptoms referable to anemia? The symptoms and signs depend on the severity of anemia. There is inadequate delivery of oxygen to the peripheral tissues. The common symptoms are weakness, fatigue, lassitude, lightheadedness, giddiness, fainting or syncope, anorexia, palpitation, breathlessness, anginal pain, insomnia, tinnitus, lack of concentration, intermittent claudication, tingling sensation in the extremities and menstrual irregularities in case of female. Again repeating, the common symptoms are weakness, fatigue, lassitude, lightheadedness, giddiness, fainting or syncopal attack, anorexia, palpitation, breathlessness, anginal pain, tinnitus, tingling sensation in the extremities, intermittent claudication, insomnia, and menstrual irregularities. Importance of history taking in a patient of anemia. Present history: commonly complaining of easy fatigability, shortness of breath, and decreased effort intolerance. Past history: history of bleeding in the form of hematemesis, melena, epistaxis, menorrhagia or hemorrhoids. History of blood transfusion in the past, or diarrhea in case of tropical sprue. Any history of chronic disease like rheumatoid arthritis, chronic renal failure. Personal history: alcohol consumption, walking barefooted like in case of whipworm infestation. Family history: similar type of illness in the family suggests genetic inheritance like thalassemia, HbA disease and hemophilia. Dietary history: that should be taken to diagnose nutritional anemia because in pure vegetarians they may suffer from vitamin B12 deficiency anemia. Less intake due to anorexia, dysphagia or poverty may also be seen. Treatment history: bone marrow suppression drugs, hemolysis like in G6PD deficiency with antimalarials, NSAIDs intake, or history of radiation, or history of previous surgeries like gastrectomy or ileal surgery may lead to severe anemia. Menstrual history: full menstrual history with the amount of blood loss should be asked for. Occupational history: history of exposure to chemical solvents, lead, benzene, insecticides should be taken. A cultivator working barefooted may suffer from hookworm infestation. Geographic background and ethnic origin. Important to diagnose thalassemia, sickle cell anemia and G6PD deficiency. Now, important history to evaluate anemia. History of chronic blood loss, that is from bleeding peptic ulcer, hemorrhoids or menorrhagia. Number 2, malabsorption like diarrhea or in case of steatorrhea. Number 3, nutritional intake, worm manifestation, exposure to drugs, chemicals and radiations, bleeding tendencies and bowel habits, anorexia and loss of weight. These all are important history to evaluate the anemia. What are the common causes of severe anemia? It is the nutritional cause followed by hematemesis and melena, chronic bleeding hemorrhoids, uremia, menorrhagia, thalassemia, hookworm infestation, aplastic anemia, acute leukemias, carcinoma of stomach, lungs and colon. Importance of stool examination in anemia: presence of occult blood to diagnose hookworm ova, to diagnose the OPC, ovoparasite and cysts. Classify anemia, and this is a working classification based on morphology: normocytic, microcytic and macrocytic. Normocytic like in case of aplastic anemia, microcytic in iron deficiency anemia and macrocytic in megaloblastic anemia. Based on etiology, the anemia can be classified blood loss, which can be either acute or chronic, inadequate production of RBCs, and excessive destruction of RBCs. It seems anemia may result from nutritional deficiency, hemorrhage, hemolysis, or hypoplasia of the bone marrow. What are the cardiovascular features in severe anemia? Tachycardia, capillary pulsation, water hammer pulse, cervical venous hum, cardiomegaly or cardiac dilation, and later sign of heart failure. Hyperdynamic apex beat, mitral systolic murmur due to functional mitral insufficiencies, ring dilatation of the mitral annulus, hemic murmur over the pulmonary area. Rarely, mid-diastolic or non-rumbling murmur in mitral area may be auscultated due to relative stenosis at the mitral valve, secondary to increased blood flow. Tachycardia, water hammer pulse, cardiomegaly, and hemic murmur over the pulmonic area are the most important. Edema in general survey is a clinical clue at bedside. What are the features in other systems in severe anemia? In GIT, there is hepatosplenomegaly. In respiratory system, there may be basal crepitations. In nervous system, there may be features of polyneuropathy. Sometimes there is papilledema. In lymphoreticular system, there may be presence of sternal tenderness, though it's rare. Ankle edema in anemia suggests severe anemia per se, renal retention of salt and water, suggests congestive cardiac failure may be associated with, suggests renal or hepatic disorders, hypoalbuminemia, and myxedema. What are the common causes of anemia in this part of the world, that is India? There is nutritional anemia, that is dietary history is playing an important role. Hookworm infestation, chronic malaria, chronic Kala-Azar, tuberculosis, thalassemia, tropical sprue. Transfusion is usually required when hemoglobin level goes below 7 gram per dl. 1 unit of packed red cells elevate the hemoglobin by approximately 1 gram per dl. Lifespan of RBCs is approximately 120 days. In case of India, 2 units of packed red cells are given. Globally, chronic blood loss from chronic duodenal ulcers, hemorrhoids, or fibroids in females is probably the most common or the commonest cause of anemia.